The human heartbeat, so basic, so vital, drumming out the rhythm of life every second of every minute of every day. A healthy heart can beat about 38 million times a year or more, but when it stops or gets interrupted, the results can be tragic. According to the Centers for Disease Control, heart disease is the leading cause of death for men and women and accounts for nearly 600,000 fatalities a year. The board-certified cardiologists at the New York Heart Center are on the front line in the battle against heart disease every day. They practice at the most comprehensive private cardiology practice in New York State, using the most sophisticated and technologically advanced diagnostic imaging systems. The New York Heart Center is the only cardiology practice in the state that has the most widely used advanced imaging modalities in one office.
Heart disease is a fatal disease, and at the same time, it's easily treatable disease if we can catch it at the right time.
PET scanning, or positron emission tomography, is quite common in the field of oncology, but has only recently been applied to cardiology. It is used to detect arteriosclerosis, ischemic heart disease, and coronary heart disease, and is perhaps the most accurate method of visualizing cardiac blockages. It provides an efficient and reliable tool that allows physicians to visualize circulatory pathways to and from the heart muscle without necessitating the more invasive and expensive cardiac catheterization. PET is extremely useful for obtaining quality scans on obese patients or patients with dense breast tissue, because alternative imaging techniques often result in false positives or negative results, which can lead to further costly and unnecessary testing. A typical PET scan takes approximately 40 minutes and is usually 95% accurate.
PET scanning is a newer technology, and it allows us to eliminate artifacts. Anytime we do a test in cardiology, there is a risk of what we call a false positive, which indicate presence of artifacts in the study, which lead us to more downstream testing and more downstream investigation to find out if this is a true problem or not.
An alternative to PET imaging is SPECT scanning. While these studies are a less expensive option to patients, they take about 4 hours to complete and are about 75% accurate. The New York Heart Center offers the most advanced SPECT scanning system available. Utilizing their CardioMD SPECT cameras and the cutting-edge UltraSPECT software provided by CDL Nuclear Technologies, New York Heart Center is able to decrease the radiation exposure to their patients by half compared to the older generations of SPECT processing programs.
At CDL, we understand the challenges that cardiologists face, and we bring to them unique solutions while advancing affordable, quality patient care, something we've been doing for almost 20 years.
Cardiac CT angiography, or CCTA, is a relatively new and revolutionary way to non-invasively visualize the coronary arteries. 64-slice CT scanners enable more accurate diagnosis of arterial blockages, aortic dissections, and pulmonary embolisms by using unprecedented resolution and speed. 64-slice CT angiography can create amazingly detailed and accurate images of the heart, lungs, and arteries in just seconds. That means a faster, safer, and less expensive, non-invasive diagnosis of coronary artery disease.
25% of the heart caths in the United States at this time end up being normal, and those are for people that have chest pain, abnormal stress tests, or persistent chest pain, and the physician is concerned about underlying cardiac disease. And that group of patients, particularly the CT angiogram, is a huge advance for the patient. It's cheaper, it's more convenient, it's safer, and it's just as diagnostic.
Another emerging diagnostic tool is coronary calcium score testing, or CCS, which is also performed on CT scanners. It is becoming a very powerful tool for identifying subclinical atherosclerosis. Not all patients need CCS, but in targeted patients, especially those with a family history of heart disease, smoking, and obesity, this test provides supplemental diagnostic information, especially when compared to conventional cardiac risk factors using the traditional Framingham criteria or NCEP guidelines alone. Calcium in the heart has been shown both by pathological and intravascular ultrasound studies to be a direct marker for atherosclerosis. The presence of any coronary calcium in a patient indicates that they have atherosclerotic changes in their coronary arteries.
If no plaque is present, the patient can be managed with diet alone and more conservative treatment. It is a better and more accurate test than simply measuring the level of cholesterol in the blood.
The New York Heart Center has invested in the most advanced scanners and software that use very low-dose radiation technology so that the amount of radiation used is limited. The risks from cardiac disease far outweigh the potential risk associated with radiological procedures. For example, equipped with a cutting-edge dose-right automatic current selection technology, the NYHC's 64-slice CT scanner takes 2 preliminary views of the patient to record his or her body size. This enables specific radiation dosing tailored to each patient's size.
Our CT scanner has been programmed. It has the software to use the smallest amount possible. And when we do our nuclear imaging, through the technology of CDL, we're able to use half the dose of radionuclide that we ordinarily would have used.
Each time an image is captured, dose-right parameters are saved to the scanner, which gives the clinicians a more efficient starting point for similarly sized patients. In addition to the advanced diagnostic imaging capabilities, the board-certified cardiologists at the New York Heart Center also provide their patients with other medical services when required. These include electrophysiology, including pacemakers, ICDs, and other cardiac devices, cardiac rehab for patients who have undergone angioplasty or cardiac bypass surgery, and 24-hour lab work. Some people have a hungry heart, others the heart of a lion, and still there are those with a heart of gold. It doesn't matter what kind of heart describes yours, the cardiologists at the New York Heart Center have a mission to keep it healthy and beating strong. Every day, these specialists are applying the highest technology and the lowest possible levels of radiation to identify potentially life-threatening heart disease. Their early diagnosis and treatment are helping many hearts continue to beat the rhythm of life. For more information about the New York Heart Center, go to ny-heartcenter.com or call 315-471-1044.